What's the big difference between the All-on-4 and the All-on-6? Well, let me tell you that both techniques are good. Actually, I've done those two techniques for a long time, and I can tell you that both work really good. What's the big difference? That first of all, if you want to perform the All-on-6, you need to have a good width of bone. And we're talking about vertical and also horizontal. You need to have a good reach of bone to perform the All-on-6. But what happens if you're going to lose teeth? You have a narrow bone and you have the sinuses also showing a lot, and there's no way you can put distal implants. Well, that's why the All-on-4 was invented. There's another thing that you should consider, that at the end, it doesn't matter if they are 4 or they are 6 implants, at the end, they're gonna have the same load that your teeth used to have. So imagine that load over a small implant, where we call the All-on-6, a small implant on the far distals, or imagine those tilt implants, which they are gonna be long implants, and they're gonna be supporting all the strength, and it works a little bit more like in physics. The physics on the All-on-6 is going to be a bar connected to 6 implants, and probably they're going to be short implants. Some of them long in the center, but they're going to be short implants on the far back. And remember that on the far back, the bone is not so strong, and it's more like a muddy. That means that the bone is going to be more softer than the anterior area. That's why doctors, when they talk about the All-on-4, they understand a little bit more about physics, because once you tilt the implants, at the end, you're gonna be doing a 45-degree angle, which is the same principle as the San Francisco Bridge, just to give you an idea. So that works really good, yes. Technically, for me, both procedures are easy to do, but in my personal opinion, I will go rather more for the All-on-4 than for the All-on-6. And probably you're gonna say, yeah, but you have 2 more implants. Yeah, but that does not matter, because All-on-4 technique, it's a bicorticalization. That means that you're gonna be holding from 2 corticals, and the other one is just 1 cortical, and it's going to be in the bone. So sometimes, depends on the patient, depends on the doctor, depends on the skills, they're gonna tell you only All-on-6 works. And other doctors, they will tell you about the All-on-4. Whoever tells you that the All-on-4 does not work, it's because they haven't done this procedure. Once you start doing the All-on-4, now you can choose between one or the other. A doctor that performs the All-on-4 can tell you that All-on-6 or All-on-4 is good. A doctor that only performs All-on-6, they're gonna be telling you that All-on-4 does not work. So do your homework, do your research, because if you're looking forward to have an amazing result, that will depend a lot on how's your case, and also who's going to be the doctor in charge about placing your implants, because it's not only placing implants. One of the biggest problems also is that you can have a doctor that only places the implants and who's going to restore them. When you search for a doctor, a dentist, an implantologist that is going to perform the implants but also restore, then you're going to have a beautiful 360 solution. When you only have a doctor that only places the implants and another doctor do the rehab, probably they're gonna say, hey, but you didn't place them really good, or I didn't want them like that. But when you search for a doctor that they do both procedures, they put the piloting and then they do the construction of the building, then you will have a full solution. I hope this works for you, and to understand a little bit more about the technique. Both are good, but do your homework. Dr. Arzate. Thank you. Bye.